like to call the meeting of the Social Services Committee to order. First item of business is approving the previous minutes. Can I have a motion to approve? Motion, second. All in favor? Aye. All those opposed? Passed unanimous. Item number 1 on the agenda is authorizing an agreement with the Salient Corporation regarding the purchase of Medicaid fraud, waste, and abuse control software and support. Commissioner McClave.
Good afternoon, evening. Yes, we're looking for authorization to approve a contract for a three-year contract with Salient Corporation. This is 100% funded by state and federal sources. It adds up to about $42,000 per year for the contract. This is a software that allows us to look at many Medicaid claims and Medicaid data and help OMIG in assessing potential fraud and abuse.
Okay, thank you. Any questions from the committee? Mr. Reinhardt?
When I read the material here, it really wasn't what I kind of expected, because it actually had several good applications. It talked about several good applications of the software. I don't want to imply that what you just said about fraud and abuse is a bad application of the software, but I guess I do have a little bit of a we are spending a lot of money on finding fraud and abuse in Medicaid. We don't seem to do this for the Pentagon budget, for example. I'm just wondering, the money that we spend to kind of find the welfare cheats and all that, are we saving money by doing that? Or I'm kind of curious about the costs and the benefits of that. I know obviously there's a big focus on it compared to some of the other ways we waste money in government. I just wondered, what are your thoughts as far as the cost benefit of this?
I think it's a very valuable investment of whatever, and I can't tell you right off the top of my head what the total county investment is for fraud investigation, but the state and the feds do pay a good portion of our fraud because they fund many of the programs that we utilize.
I noticed that.
SNAP, Medicaid.
So I'm not saying to just, give back the money, but I'm just kind of curious about.
But it's yes, we find several $1 million of fraud every year. So as a deterrent effect, I think it's very, very important that we do that we let people know that we're looking at the applications and we're making sure that everything is correct in the way it should be. And if it's not, we're gonna find it and we're going to get that money back from you if we can. So, and we also prevent, we have front-end detection. This is off kind of this area. This is one piece of our fraud investigations. This is for Medicaid. So, and the staff person that does this fraud, Medicaid fraud investigation is also 100% state funded. So this is in the state's interest. Medicaid investigation is in the state's interest. So they fund this component 100%. And along with 50% is funded for this software from the feds as well. So, yeah, it's, as I was saying, front-end detection is also when an eligibility examiner might take an application and see something seems off, or there's pieces missing, or there's someone in the household they know about that they're not reporting, etc. And then the fraud department takes a look at that a little deeper and make sure that they're eligible. So even before we give out benefits, they're preventing people from accessing the benefits.
Yeah. Now, one other point, I just wanted to make sure I'm understanding how the software is used. In the description, it talked about what I think were two other applications, and I want to make sure I understand that. One was the pharmaceutical issues, the opioid issues, and the lawsuit that the county is joining with many others, and that the software was helpful in us establishing some of the parameters of that lawsuit, right?
That was just, these are just two examples of additional things that this software can do for us that we've done recently. So we looked at the expenditures on opioids and how they changed over the years. That's kind of what we did with that.
Yeah, and also, if the service providers are committing fraud by overcharging for either,
Yes.
whether it's medicine or service or whatever, this software is helping us identify that as well.
Right, we look at any big charges, like very large, unusually large charges, or repetitive charges from the same provider that doesn't make sense. You know, a pharmacy that's charging, you know, 1,000 a day kind of thing, or something like that. That'll pop up in this software, and we'll drill down into it if we notice something like that. So, and also, the value of this is we get to use this, there's 6 user licenses, so we can use this for other purposes within the agency, other data gathering within the agency. It will tell us a lot of data on our other programs, our SNAP program, our temporary assistance program, et cetera. So we use this for, it's valuable to us in beyond just the Medicaid investigation.
It's, we've only been, I think, because I was on my first term when we made a contract with Salient, because, and it was very, very new, and I was a big supporter of it then, because we really weren't paying attention to any of the fraud at all. And they've done a terrific job at Farrar Junior, I think.
It's a really good
uncovering.
software. It's really easy to use.
We want to help people that need help, but
Yeah.
not people that want to
Right,
defraud the
that's right.
system.
Or for others.
Can we get routine reports on the fraud findings?
I could give you probably, I don't know what routine, how would you define routine?
How often is it produced? Is it
Well-
monthly, quarterly?
Yearly, we look at our total fraud. I think that we can probably get it
Quarterly?
monthly, but quarterly might be
Okay.
more accessible.
Just to get a sense of the trend
Like how many detections there are, or
in the amounts.
It would be good if you could sort that by what the old process was and what this new software is able to do, so that you can actually see that cost benefit coming through.
Well, this software we've had since, I think, 2006.
Okay.
So we've had this for a really long time, so I'm not sure if we're gonna, yeah.
Yep.
Well,
It has
what I
been.
thought Merton was asking, which I hadn't thought of until Merton suggested it, is if we could see year over year or every so many years, a downward trend in some of the issues that we are addressing with the software, that's like really good information, because that's telling us that, you know what, we're changing behavior of various actors here. If we're you know, catching, I don't know what the numbers are, let's say $6 million in year 1. And then by year 3, it's only down to 2 million because, you know what, people are realizing that, you know, we have this great software, and it's a preventive tool, if you will. That would be great to know.
I'll see how we measure it, and I think I'm gonna have a hard time bringing it right back to the Salient software, because there's so many other ways that we investigate fraud. But I can give you a Medicaid
Tool.
fraud total, I can give you probably SNAP fraud total, I can give you by program total. And this will, this is one piece of that.
That's still useful information.
Yeah.
You know, to see that, okay, we've got this and we've got these other things in place, we put them in place now. Are they working? Are we seeing a trend, as Merton said?
Yeah.
Thank you. Yeah, I think those statistics would be very helpful. Are there any other questions from the committee?
I'll make a motion.
Second. Okay, all in favor? Aye. Those opposed? Passed unanimous. Okay, item number 2 on the agenda, authorizing an agreement with ChemRx Pharmacy Services LLC regarding pharmacy services for the nursing home.
Good evening. Here to request authorization to renew the contract with ChemRx for another year. This will be the 3rd year of our contract with them. They're a great firm, they're a local firm, they're located on Walker Way, they're very responsive to our needs, both stat orders as well as consultation. We meet with them monthly to go over our trends, what we're doing, what we can do to improve, look over the cost of some of the drugs, see if we can, we met with the medical director, administration, and nursing staff as well, to see if we can trim costs based on usage, use generics, and whatever needs be to reduce the outlay for the county.
Thank you. Are there any questions from the committee?
Make a motion.
Motion?
Second.
There's no question.
All in favor?
Aye.
Those opposed? Pass unanimous.
Thank you for having me.
Thank you. Okay, next item on the agenda, item number 3, authorizing an agreement with Schenectady County regarding evaluation teams services. Commissioner DeHagen?
Yes, good evening, everyone. So the department requests approval to continue the contract that we've established with Schenectady County for evaluation services. Schenectady County does not currently have their own evaluation team, so Albany County has been approved through DOH to be able to facilitate evaluations when it comes to speech, physical therapy, in order to assess whether or not these youth meet the criteria to actually receive those services. This has been a valuable contract as it does generate revenue for the county, and so we'd like to request legislative approval to continue to have that contract.
Thank you. Any questions from the committee? Mr. Reinhardt?
I like this. I like this when we're generating revenue by providing service to people. Is there, my only questions are two. One, can we do more of this? Like with Saratoga County or Rensselaer County or another county to generate more revenue? But two, and obviously related, is I wouldn't want to see us providing this service to in any way diminish the services to our own special needs population.
Absolutely. So Albany County youth are prioritized, and actually that is the youth that receive the significant amount of services. When we look at the number of evaluations that were facilitated last year, of the 184, over 170 of them were Albany County children. So we definitely prioritize Albany County youth, but it's good to be able to, when we have the ability to extend and generate revenue by providing to other surrounding counties. In the past, we have provided this service to other counties such as Schoharie and Greene County as well. So if they make the request, we can certainly provide it to them as well.
I'm just thinking that request might happen more often now with, I have a special needs child myself. I'm familiar with that community in Albany County, at least in Bethlehem. And there are service cutbacks happening everywhere because of the 2% tax cap, et cetera. So there could be other opportunities where other counties will choose to no longer provide that service when, from their perspective, they can get it more economically by hiring it out to us, you know, on a limited basis. So I just encourage you to keep the eyes open.
Absolutely, as long as we have the capacity,
Right,
we're more
right.
than willing to do so.
Right.
Thank you. Any other questions from the committee? Okay.
Make a
Motion to
motion.
approve?
Second.
Second. All in favor?
Aye.
Aye.
All opposed? Pass unanimous. Item number 4 on the agenda, authorizing agreements regarding the Healthy Families Home Visiting Program.
Yes, the Healthy Families Home Visiting Program has been in Albany County for a number of years now, since 1995. It's a home visiting program. It works with parenting and prenatal families, really to provide additional supports to those families who could benefit. It helps them with child development, with parent-child interaction, and with establishing self-sufficiency, identifying goals, and really working towards independence. We've seen the program continue to flourish. It is an evidence-based program, and so there are performance indicators that we need to meet on a monthly and quarterly basis. And this last performance indicated quarter, we actually did well in terms of having surpassed or achieved at least 11 of the 12 indicators for the program.
Great. I want to ask, how do you select the families that are part of this program?
Sure, it's a referral program, so we do a lot of outreach to those stakeholders and agencies that we feel that we'd be able to locate families. So that includes the hospitals, includes health clinics, WIC offices, believe it or not, high schools, because, we do have parenting teens. And so really, it's providing the information to these various agencies and sources in order to generate referrals. We have our single point of entry, so that is a centralized point for referrals to come in. The criteria is that the child does have to be between 0 and 3 months of age, again, because it is a evidence-based program. There is a tracking and a data that has to be met, and so part of the criteria is they cannot be older than 3 months at the time that they enter into the program, but once they are in the program, they're able to stay with the program for up to 5 years with the goal of when they do successfully complete, the child is either entering Head Start, pre-K, or kindergarten.
Great, thank you. Any questions from the committee? Okay, hearing none, can I get a motion to approve? Second? All in favor? Aye. Those opposed? Pass unanimous. Item number 5 on the agenda, authorizing memorandums of understanding between the County of Albany and various school districts regarding administrative expenses for the provision of special education services. Commissioner?
Yes, so this is a program for our preschoolers between 3 and 5 years old who have been approved to receive services that are not currently affiliated with a center-based program. So Albany County has actually been approved as a special education itinerant teacher provider. And so in those instances, when these youth are not linked to another service, we are able to facilitate those services, and we're able to get administrative reimbursement from the school district for facilitating those services.
Thank you. Any questions from the committee?
I'll only make the same comments I made before.
Is it 100% reimbursement from the school district?
No, there is I'm going to say that it is,
It says 100%.
actually, no, it's 100% local. It's 100%.
Okay. Okay, thank you. Any other questions? Okay, motion to approve? Second?
Second.
All in favor?
Aye.
Those opposed? Pass unanimous. Item number 6 on the agenda, authorizing preschool education services agreements for children with special needs ages 3 to 5.
Yes, so this is referencing the same population. These are for the children who have met the criteria and been approved to receive these services, and they're actually linked to a center-based program. These programs are approved through New York State Education. The rates are set through New York State Education. There are times when we do not know what these rates are, and we have to make adjustments based on once we receive notification of the rates. I will say that we have seen quite a growth in the numbers of youth that have been approved for these services. In 2015, we served about 651 children. As of the 17-18 school year, we're over 800 children. So you will see that the appropriations for this line has increased over the years. We're currently appropriated for over $12 million, and I'll tell you, we're not sure if that's going to meet the need this year because of the increase in the number of children. So yes, it is good. The service is there, and families are taking advantage of it, but we're certainly also seeing the increased costs associated with that.
Thank you. Any questions from the committee?
I do have a question. 2, it looks like from the materials we have that 55% of this is coming from the state, and then we are handling 39%? And then
Yes,
the other 6 is...
it is a shared cost, so there is 55% reimbursement for the state and 39% county, correct?
Now, one other question is, I think it was last year, I remember there were some individuals who came and testified at a public comment period about, I think it might have been this program, that's what I want to try to clarify. They were providing special ed services for preschoolers, I believe it was, and they made the statement, several of them, that they haven't had a pay raise in the hourly rate that was authorized for a real long time. And that the rates were, I don't remember what they were, but they were relatively low. Again, I'm speaking as a parent of a disabled child who's now 25, so she's not eligible for this. But the service providers in serving the disabled population are often in my opinion, extremely underpaid. And I don't really know what the case is here. Like, can you say what rates are we providing the service providers under this program? Is it a simple number, or does it vary depending on the service that's being provided? And
Well, these providers are actual center-based providers, so we're not setting those rates, and so those providers are actually employed by these agencies, so they're not our direct employees or, the individuals actually providing the services aren't our contracted entities. We're contracting with the agency itself, who hires these individuals and will set their salaries or hourly wages.
that actually, I think, is a different case from what I was referring to. I think what I was referring to was where these people are hired to not work at a center, but to go into people's homes and provide services.
Okay, you're referencing the related services, which is actually another one of the requests that we have before the committee tonight. Those are the related services, and yes, currently for a 30-minute session, that rate is $55 per 30-minute session.
And has that rate changed in the last several years?
Actually, it did change. It actually did go up. I want to say this was 2018, so I want to say about 2015.
No, it's state.
Yes, this is a rate that is set by the state, but it did actually go up within, I know we visited this issue, I want to say maybe around 2015 that it did go up.
Okay. All right.
But we don't get
Thank
to
you.
set that rate, the state does.
I have a question. I'm wondering, how do the school districts identify children with disabilities at the age of 3?
That's through the preschool committee for special ed. So they have specific persons that is their task to facilitate the necessary assessments and evaluations, and they come together and review the information and then make a recommendation as to what services that child would be approved for based on the results of those evaluations. So it is a committee process.
So that committee is a committee within the school districts?
Correct.
Each school district has what was it called, a preschool?
The CPSE, Committee for Preschool Education.
Okay.
CPSE.
Okay, thank you. Any other questions from the committee? Okay, hearing none. Motion to approve? Second? All in favor? Aye. Those opposed? Pass unanimous. Item number 7 on the agenda, authorizing service agreements regarding individualized education programs for children ages 3 to 5.
So this was the other program that was just being referenced in regards to the related services. So these may be that are not in a center-based program, but they have still met the criteria to have these additional services because there is a specific area where there has been a developmental delay identified, and so then there is the opportunity for them to be provided with these related therapies.
Thank you. Any questions from the committee?
I'll make a motion.
Okay, motion.
Second.
Second. All in favor? Aye. Those opposed? Pass unanimous. Item number 8 on the agenda, amending Resolution 95 for 2018 regarding a part-time law enforcement coordinator for Children's Advocacy Center.
Yes, so we just needed to represent this because the resolution had the contract term as January 1st, 2018. Actually, I think it had it, the terms were wrong. In a nutshell. It had the contract ended on January 31st, 2018. So we just needed to represent it so that we would have the correct contractual terms.
Okay. Any questions from the committee?
Motion? No.
Okay, second. All in favor? Aye. Those opposed? Pass unanimous. Motion to adjourn?
So moved. Second.
All in favor? Opposed? Meeting is adjourned.